The 3rd of December has been denoted worldwide as International Day of Persons with Disabilities by the United Nations since 1992. This day aims to promote the understanding of the issues relating to mental disabilities and getting support for the rights and well-being of the people with these disabilities. With this view in mind, I, Ms.Srabani Banerjee, the founder principal of Tagore Foundation School Kolkata, would like to share some thoughts and details on the subject of mental disability, its causes, identification and prevention. Mental disability as significantly sub-average intelligence impairments in the adaptive behavior and manifestation before the age of 18 years. That is, mentally challenged people are low intelligence and cannot fully adapt themselves to a given situation. Also, the symptoms and characteristics of mental disability can be noticed before the age of 18 years. Therefore, the following 3 components are: the individual has an IQ score of less than 70, whereas a score of 85 to 115 is considered average. Deficit in adaptive behavior, that is, in sensory motor skill, communication skills, self-help skills, and socialization skills, etc. As for example, if a 3-year-old child with no physical problem does not walk, or a 10-year-old child does not have toilet control, it is considered to be a deficit in their adaptive behavior. The developmental period, which is considered to be the period below the age of 18 years. Very often, a mentally challenged person is confused with a mental ill person, but they are not the same. Mentally ill people have normal development of physical and mental abilities. It is a disease that can occur at any age or in any highly educated people. It is mostly curable with medicine. Whereas mentally challenged is a condition. It cannot be cured, but they can learn many skills. Classification of mentally challenged is done from 3 angles: medical, psychological, and educational. The medical angle is mainly considered with the cause of the retardation. The psychological angle is concerned with the intelligence level of the individual, and the educational angle is based on the current level of functioning of the mentally challenged person or child. Thus, an individual considered as mild from a psychological point of view will have an IQ score between 50 to 69. This person will be considered as educable from an educational point of view. Similarly, a moderate person will have IQ between 35 to 49 and will be considered trainable. A severe person will have IQ between 20 to 34 and will be considered custodial. A profound person will have IQ score below 20. A major problem that is faced in judging the prevalence of mental disability is lack of structured and exhaustive survey of the population in different countries. Also, since in many cases a mentally challenged person is not easily recognizable estimating the number becomes difficult. Now, let's go the different characteristics of mental disability. Physical characteristics. Generally, they have a marked delay in their developmental milestone compared to normal children, such as in their sitting, standing, walking, talking, and so on. Some may have poor motor coordination. Some clinical features of the individuals are microcephaly, that is, a very small head, hydrocephaly, a very large head, a child with Down syndrome has very distinct features such as slanting eyes, flat nose bridge, flabby skin, little finger turned inwards, wide gap between toes and the next toe, the fissured tongue. Those mentally challenged with cerebral palsy will have spasticity of the limbs and may have drooling tendency. Some mentally challenged persons have multiple problems such as hearing impairment, visual impairment, etc. Some social characteristics: short attention and lack of concentration, do not get motivated to do any task. Most problematic behaviors in mentally challenged children can be controlled by systematic intervention. Speech and language characteristics. First thing, delay in speech, language, and communication skills. Second is, some mentally challenged children are non-verbal, having limited knowledge of common objects and difficulty in understanding other speech. Some of them speak in sentences which may be grammatically poor. Some children cannot ask questions. Some children can hear but are poor listeners. Ear infections are common in children with Down syndromes. It is essential for the teacher to keep in mind the characteristics of every child she deals with, because she is required to plan a teaching program based on the child's all-round profile. There are number of causes for the occurrence of a mentally challenged child, such as preconceptional, prenatal, natal, postnatal factors. Preconceptional factors means before a woman conceives. Preconceptional factors are history of mentally challenged in the family of either the husband or the wife, maternal age at conception, history of infertility or repeated abortions. Second is prenatal. Factors affecting during pregnancy are called prenatal factors. Infections in mother such as jaundice, chickenpox, measles, especially in the first 3 months of pregnancy. X-ray exposure of the abdomen, drug intake without medical advice, Rh blood incompatibility, pregnant woman consuming alcohol and tobacco is harmful to the growing fetus during pregnancy. An extra chromosome may be formed resulting Down syndrome. Maternal malnutrition also causes birth of mentally challenged child. In natal cause, the factors affect the child during the birth: premature delivery, prolonged labor, delayed birth cry, lack of oxygen supply to the child's brain may damage the brain. Inappropriate use of forceps, etc. Postnatal causes. The factors affecting after the birth of the child. Low birth weight, metabolic disorder, meningitis, encephalitis, epileptic fits, measles, chickenpox, head injury, poor nutrition, jaundice in infancy and childhood. Some steps for prevention. Regular medical checkup during pregnancy. Second one is intake of healthy and nutritious food. Third is not carrying heavy weight. Then, if the elder child is mentally challenged, it is better to get medical advice before having another child. Maternal age of conception should ideally between 20 to 30 years. After birth, the child should be duly immunized. Epileptic tendencies should be consulted with doctors immediately. If there is a delay in the development of the child, such as in sitting, standing, walking, or talking, immediately professional attention should be sought. Some mentally challenged children may have associated problems. This is called multiple disabilities. Cerebral palsy with mental problem is also called multiple disability. To end this session, I would like to point out that having a positive attitude is always helpful, as this will lead to early acceptance of the problem. This will in turn lead to early professional attention. Early intervention will surely lead to better training of the mentally challenged person, and this will ultimately lead to be a better quality of life. Our aim or goal will always be towards self-improvement, self-empowerment, and self-dependence of a mentally challenged person. Only this will enable him or her to gain self-respect and earn the recognition of the normal society. Thank you.